When you hear the word dementia, it's easy to feel a sense of dread, right?
Absolutely.
It's a global challenge, and it's only becoming more common.
What's really remarkable about this report is the sheer optimism it offers.
But what if I told you that we're on the verge of a revolution in how we understand and potentially prevent this disease?
We're moving away from a sense of inevitability and toward a future where we have more control over our brain health than we ever thought possible.
That's what makes this 2024 Lancet Commission report so fascinating. It throws open the doors to a whole new world of possibilities. Okay, let's unpack this. The report's headline claimed that nearly half of all dementia cases could be preventable. That's huge.
It means we have more agency than we realized.
But what does that actually mean for, the average person?
For someone who might be worried about their own risk, maybe because of family history or lifestyle choices, this report is a game changer.
So it's not just about genetics. It's not a foregone conclusion.
Exactly.
Give us an example. What's one thing from the report that really drove that point home for you?
Well, take smoking. We've known it's bad news for your brain, but this report highlights that quitting, even in midlife, not just in your younger years, might have a bigger impact on dementia risk than we previously thought.
Wow, that really underscores the never too late message. But before we get too far into the weeds, let's clarify something for our listeners. We're not just talking about, forgetting where you put your keys.
Right. Dementia is far more complex than simple forgetfulness.
And that's where the concept of cognitive reserve comes in, right? The report really seems to emphasize building up those reserves. Can you break that down for us a bit?
Imagine your brain as a bustling city with a network of roads and bridges.
Okay, I love that analogy.
Yeah.
So building cognitive reserve is like giving our brains a leg up, making them more resilient. Now let's talk about the risk factors themselves. The report covers some familiar ones: smoking, diabetes, the importance of staying socially connected. But there are also some surprising additions to the list.
Untreated vision loss is a big one
Yeah, that really jumped out at me too.
that many people might not immediately connect to brain health.
It's like what's bad for my eyes could also be bad for my brain. How does that even work?
It's fascinating, isn't it? There are a few theories at play. One thought is that if you're not seeing well, you're less likely to engage in activities that challenge your brain. Things like reading, socializing, even just navigating your environment.
Right.
That lack of stimulation can take a toll over time.
So it's like those sensory experiences help keep our brains active and engaged.
Exactly. And there's also evidence suggesting that there may be some shared underlying mechanisms between vision loss and dementia, like inflammation and vascular problems.
Okay, so there's a lot more going on than meets the eye, literally. The report also mentioned high LDL cholesterol as a risk factor. That's another one that people might not immediately associate with brain health.
It's true. We tend to think of cholesterol in terms of heart health,
Right.
but it plays a role in brain health as well. High LDL cholesterol can contribute to those vascular problems we were just talking about, damaging the blood vessels that supply the brain with oxygen and nutrients.
Another reason to keep an eye on those cholesterol numbers. Now, beyond the individual risk factors, the report also delves into some important social and systemic issues, right?
Absolutely. One of the most crucial points the report raises is the issue of health equity.
Okay.
We can't talk about dementia prevention without acknowledging that not everyone has equal access to resources and care.
Right. The report specifically mentions that dementia incidence and prevalence are often higher in minority groups. What does the report say about why that might be?
There are a few factors at play.
Okay.
One striking observation is the difference in reported dementia cases depending on the source. The report highlights that dementia incidence and prevalence are often higher in minority groups when measured through population-based surveys compared to electronic health records.
Interesting. So the way we're gathering data might be masking the true extent of the problem in certain communities.
It's a real possibility, and it suggests that there may be underdiagnosis or barriers to healthcare access in those communities.
Yeah.
It underscores the need for culturally sensitive outreach programs and equitable access to early diagnosis and treatment.
Absolutely. We need to make sure everyone has the information and support they need to protect their brain health. Now, speaking of support, one of the things that really stood out to me in this report was the emphasis on non-pharmacological interventions. In other words, things we can do beyond just taking a pill.
Yes. While there are medications to manage cognitive symptoms, this report shines a light on the power of lifestyle changes and holistic approaches.
So give us the rundown. What are some of the most promising Non-pharmacological interventions.
Well, it's not just about one magic solution.
Right.
It's about creating a lifestyle that supports brain health across the board. Think about it like this. You wouldn't expect to just pop a vitamin and be perfectly healthy, right?
Right.
It's about nourishing your body with healthy foods, getting regular exercise, and managing stress. The same principles apply to brain health.
So it's about a holistic approach.
It is.
What are some of the specific things people can do to incorporate that brain-healthy living into their lives?
The report highlights the importance of things like staying physically active,
Go ahead.
eating a balanced diet rich in fruits, vegetables, and omega-3 fatty acids. Right.
Managing stress through practices like mindfulness or meditation,
Yeah.
and staying intellectually engaged, whether it's reading, learning a new language, or even just doing puzzles.
It's like cross-training for your brain. I love that. And you mentioned social interaction earlier. That's a big one, right?
It's absolutely crucial. Maintaining strong social connections and engaging in meaningful relationships has been shown to have a protective effect on brain health.
So joining that book club or volunteering in your community isn't just good for your soul, it's good for your brain too. Okay, that's a lot of great advice for supporting brain health naturally. But the report also touches on some pretty cutting-edge research, like the potential of biomarkers.
Yes, this is where things get really exciting. We're moving toward a future where we may be able to identify individuals at risk for dementia even before they show any symptoms.
Using things like blood tests or brain scans.
That's incredible. It's like getting a sneak peek into the future of your brain health.
Exactly. Early detection through biomarkers could be a complete game changer. It opens up the possibility of intervening much earlier, potentially slowing down, or even preventing the disease process altogether.
That feels incredibly hopeful. So what's the takeaway for our listeners? What should they do with all this information?
This report is a call to action. It tells us that we have more power than we ever realized to protect our brain health and reduce our risk of dementia.
We can't just sit back and wait for science to catch up. We have to take ownership of our brain health today. And on that note, I want to leave our listeners with one final, thought-provoking question to ponder. This report states that nearly half of dementia cases are potentially preventable. That's a powerful statistic. So the question is, what are you personally willing to do to embrace that possibility? What changes can you make today to invest in your brain health for a brighter tomorrow?
That's a question worth reflecting on. It's about recognizing that we're not powerless in the face of this global challenge. We have agency, we have options, and we have hope.
And on that note of hope and empowerment, we'll leave you to dive into those thoughts. Thanks for joining us on this deep dive into the future of brain health. Until next time.